I'm a primary care doctor, and I have the privilege of coming to work every day to help patients, some of whom I've known for 20 years. So that's probably my joy. I've had the additional privilege of being in a role with Unity, where I get to affect how we care for all of the patients that our group touches. And my title there is the Director of Care Delivery Transformation. In my role with Care Delivery Transformation, I really see three main areas that we're trying to impact with regards to how all of our doctors care for patients. The first role is with taking the sickest patients, identifying them as a group, and trying to provide a little bit higher level, more intense, more thoughtful, more proactive care. That's our high risk program. The other role is education of the providers. So all of our providers, I meet with them quarterly, and I'm trying to educate them on tips and tools and documentation and care delivery to do a better job for their patients. And then finally, as a group overall with our inpatient care and transitions of care, trying to connect patients who are transitioning from inpatient to the nursing home, back to the home, and trying to provide a system and structure that helps connect those transitions a little bit better. The high-risk care program takes maybe the sickest 5% of our patients, and we have a nurse practitioner. We have myself 2 days a week. We have 2 nurses, and we have 3 medical assistants actively reaching out, number one, proactively. So those patients in the high-risk program will get a phone call even when they're well, just checking in with them, assessing their weights, assessing medications, assessing any needs that may be new or different. So we're reaching out ahead of time, trying to be proactive. Our nurses will do home visits as follow-up. So just maintenance, going out to check on a patient who's been sick, maybe checking on a patient who just got out of the hospital, making sure, do they have all their medicines? Do they have questions? Do they understand kind of the care that they received and what the next steps are? So when I looked in this community where I'm raising my family, I didn't want to leave the community. I didn't want to leave my patients. I really was looking, and this is what I tell my residents when I say, this is how you pick where you should work. Number one, you should pick it based on the people. And I literally made my decision not based on money, not based on job hours. I picked Unity based on the people I had met and feeling like I most connected and was most like them, and that their approach to medicine was most like mine. That's why I chose Unity. I was an employed physician. I was a program director. I was, very much an employed setting. Coming here to where the biggest highlight for me is where the physician and the physician's thoughts and needs and wants are really at the top of our list of importance. It is really truly a physician-led group. I think that can be good and bad, but in this setting, I think there's enough checks and balances where it's a very powerful tool to do good. It's also very empowering to me as a physician to know if I have a concern, if I see something we could do better, they actually want to hear it, they actually listen. The group tries very hard to meet my needs because Unity has understood a happy doctor is a successful doctor, which is a doctor who's providing better care. For me, the most important thing is that I do what is kind and what is good, not what is expedient, not what my schedule forces me to do. I don't want to live life that way. I told my students and my residents when I was training them, I said, I call that busy doing nothing. You're very busy, your schedule's very full, but you're doing nothing because you're always rushing on to the next patient. I need to take time when you need to take time.